So the IOP pathway and route is very fundamental to understanding the whole thing. So when we say this is the IOP pathway, so you have, this is the iris, okay, this is the iris, and then you have the ciliary body. So this is the entire eye, okay. So this is the okay, so this is the eye, okay. So what we have here is, this is the iris. So the pathway for aqueous humor is, this is the lens and the pupillary area. So the aqueous humor is secreted at this area, it's secreted in the ciliary epithelium, okay. So this is the angle, this from the ciliary epithelium the aqueous humor flows, and this is the route, it flows like this, okay, then it flows into the anterior chamber angle, this is the anterior chamber. So it flows like this, it flows in the anterior chamber angle, and here you have the angle. So in this portion you have the trabecular meshwork. So this is the trabecular meshwork, and then this is the outflow pathway. So in the trabecular meshwork you will have the Schlemm's canal, and then you have a uveoscleral pathway here. Okay, so the drainage takes place in these areas. Now, this is the IOP normal pathway and the normal route. So, the target IOP will be calculated based on the functional damage to the visual field, the structural damage to the optic disc and the retinal nerve fiber layer, the existing central corneal thickness, the age of the patient and associated systemic diseases and general health of the patient. Glaucoma therapy is lifelong, so we should make a proper diagnosis and start the patient on the appropriate drugs, only then it will work. It is also an expensive, anti-glaucoma medications is a lifetime investment, so you need to choose the drugs appropriately, because compliance is based on the expense. If a patient cannot afford the drugs, they usually stop the drugs, and hence the glaucoma will progress. So usually we start the patient on a unilateral drug trial, and we call them back after about 2 to 3 weeks and assess based on the intraocular pressures. We know whether the patient is compliant and responding, and then if we feel that he is not responding, we can add another drug. So we call that a combination therapy, and then we try the same thing, and then we extend it to the other eye. But suppose medical management is not working, then we can start a laser, we can plan a laser procedure for the patient, and if both are not working, then we think of surgery. So this is the usual medical, laser and surgery. These are the 3 options available for glaucoma management.